Hey everybody, I'm here with Dr. Hisham Seify at Newport Plastic Surgery. You can find him at newportplastic.com. So we're here to talk about cosmetic surgery and some of the new treatments and procedures out there available today. So Dr. Seify, thank you very much for joining us today. I appreciate it.
You're welcome. Thank you for having me.
Absolutely. I wanted to just start off asking how long you had been working as a plastic surgeon.
Probably more than 20 years, and in my current location, about 17 years.
Okay, awesome. Was there anything in particular that drew you towards that, made you want to help patients with those goals?
So plastic surgery is a decision that was made in medical school. So as a medical student, I went and I did a rotation in France, and there was a pediatric plastic surgery, and I just fell in love with the specialty. It's one of these specialties that you can really do a lot of things between cosmetics and hands and craniofacial and so forth. And then after I finished, and then I super specialized into cosmetic surgery.
Okay. And what are some of the main treatments and procedures that you focus on there at your practice?
So I did two fellowships. One was in eye surgery, so I do eyes and eye revisions, and the second one was breast. So I do a lot of breast, both on the revision types, cosmetic breast, augmentation, lifts, and so forth, even reconstruction of difficult cases. And that's kind of, I think, most of my practice now. Everyone, when they come for the breast, a lot of times they want to do liposuctions or a tummy tuck or something like that. So it ends being body treatments as well.
Okay. Yeah. So patients will come in just for the breast procedure and end up doing those with you as well.
True, that's true.
Okay. And so with those procedures, do you typically do like the fat grafting, or what do you typically do with the like the liposuction? Do you just do like a normal implant with the breast augmentation?
So let's talk about one by one. So for liposuction, a lot of people come in just for lipo, just for shaping, and then some would like to use the fat to augment other parts of the body, like the breast, the buttocks, the face, and so forth. So it really depends on the indication for it. Just shaping by itself usually gives a pretty good result. If someone want to enhance a little bit more, then it obviously could be done. By the way, liposuction could be done either under local anesthesia or under general anesthesia, so both. When it comes to breast implants, so basically breast augmentation could be done either with breast implants, and these are either saline or gel, or can be done with fat grafting.
Okay. And so when you said that you can be done either under general or local anesthesia, is that just on the patient's preference, or what determines that?
There are two items. One is obviously the patient preference, but also the number of areas you want a liposuction. So if you're coming for two, one, maybe three areas, yes, you can do under local, but if you're going to do 10 areas, I don't think local is going to work. You need to be under general.
Okay. And then do you find that, most patients when they come in, they have a pretty good idea of what they're already looking for, or do they, kind of refer to you and ask what you can achieve with that?
I think with the internet and people going in and reading about procedures and looking at videos and so forth, they come with a lot of knowledge. That could be good or bad. And my job is to make sure to kind of give them the scientific background of everything, and then just tell them my opinion, and also making sure their expectations are realistic, because you want to make sure that they're not trying to look like someone else, because that's basically not going to happen.
Right. Yeah, that makes sense. Do you find that like with the facial procedures you were talking about, so with the eye ones, you said those are mostly revisions, or do you do a lot of primary ones as well?
So both. So we get a lot of primary ones. So patients who want to do blepharoplasties, upper lid lift, lower lid lift, and what we call cheek lifts, adding fat grafting to the face. And a lot of them ended up combining it with a facelift, like a lower face and neck lift. So we get these, and then also we get the revisions, patients who have previous surgeries, and now they have, doesn't have to be a complication, just something that needs to be fixed. So they come to us as well.
Okay. So it's not always that, they were unhappy with their initial result that they got from it, but maybe just that some time has passed and they're looking to kind of rejuvenate that again?
That's true. So some patient had a blepharoplasty 15 years ago or 20 years ago. Obviously, things changed, they aged. Now it's time to do another tweak, basically.
Okay. And is that typically how long the results will last with those, is about 15, 20 years?
It's hard to tell. We like to use 10 years as kind of a benchmark, but to be honest with you, very different about aging, weight loss, weight gain, smoking, no smoking. If you live in Arizona or Florida versus another state, exposure to the sun,
Sure.
So many factors can change that number.
Okay. What do you typically recommend for patients to do to be able to help, maximize those results?
Yeah, great question. So first, you have to prepare them for the procedure. So I try to make sure patients don't smoke before surgery. It makes a big difference in our surgery, especially like a facelift procedure. Number two, we have to make sure they're healthy. So we run labs on them, their nutritional status. We make sure they take the right supplements for it, and also stop the wrong supplements that can cause too much bruising or bleeding. Now, after surgery, we recommend, obviously, especially for facial procedure, to stay away from the sun or to apply a sunscreen that's 50 or more.
Okay, that makes sense. And what's the average surgical and recovery time with those procedures?
So our surgeries usually vary between 3 hours to 5 hours. Now, if you're just doing an isolated leg lift, I mean, this could be a 30-minute procedure. If you're doing a breast augmentation, it could be under an hour. But if you're doing multiple procedures, that usually is 3 hours average, and sometimes it goes up to 5. I try not to do too long procedures. I think patients recover much better when the surgery is limited to a certain extent. Having said that, if the patient is healthy, labs are fine. They can do very well with 5-6 hours.
Okay. And then, obviously with the advancements in these kind of procedures and the different, techniques that are available these days, is there, specific instruments or anything that you use for them, or is it really just your expertise that allows you to get those results for patients?
I think all of the above. Definitely medication changed a lot, especially under general anesthesia. The new medication for anesthesia makes a big difference in recovery.
Mhm.
And they're requiring less narcotics. Using blocks and local anesthesia while doing a general anesthesia case makes the patient very comfortable immediately after surgery. They don't have to take a lot of narcotics. They don't get constipated and so forth, and they're able to go back to work much sooner. I think instrumentation wise, we definitely have better instrumentation that when I started, plastic surgery 20 years ago, and also techniques. I think we have definitely refined techniques, and if you just focus on your technique and you continue evolve it, you end up getting better results for sure.
Yeah, absolutely. I could definitely see that. And so we talked a little bit about, what patients can do to help maximize those results. Who would you say is really a good candidate both for the facial procedures and then also for those body ones we were talking about?
The best patient in my mind is someone who, first of all, really needs the procedure. You know what I'm saying? And someone who had a mom who had 2 or 3 kids. Now she's coming to do her breast and her body. Well, it makes perfect sense. The kids stretch the abdomen and the breast. Now it's time to do what we call a mommy makeover, which is a combination of a breast and tummy procedure and plus or minus liposuction. That person have to have realistic expectation. And that's, for me, a very important part. We try to spend as much time as possible. We even sometimes ask them to look at our website and look at patients and tell us which one you kind of think you want to look like. And my idea is not to make them look like someone else, but more to read their mind. I want to know what they're thinking about.
Yeah.
And if they come to me with something totally unrealistic, I have to spend more time explaining that.
Yeah, definitely. That makes a lot of sense. And so for those mommy makeover procedures, they also need to be, done having children as well, right? If you're going to do, yeah.
Absolutely. First question is always, are you planning for more kids? And if the answer is yes, then, see you in 2 years. If the answer is we're not sure, maybe 5 years down the road, then we sit and discuss the pros and cons, basically.
Yeah. Okay. And then last thing, I was curious, if patients may be thinking that they would be a good fit for either those facial procedures or the body contouring ones, what do you recommend is their, first best step in that process?
The first step is obviously to have a consultation with a board-certified plastic surgeon and know exactly the pros and cons of the procedure, have it done in the right time for them. These are elective procedures. They're not emergencies by any means. They need to be done when the patient has time for it. There is no stress. There is good support in the family. From a health standpoint, it's their best health. That's why we check labs and EKGs and things like that. And then agree on a good plan, a plan that's realistic and at the same time that's within the norm. So if someone comes in and requests an implant, for example, that's too big for their body, we have to make sure to explain that. It's like, yeah, I understand, but that's too big. I think you should go a little bit smaller, or vice versa.
Okay, so it's really just about setting like realistic expectations with those patients and making sure they can, it's actually something you can achieve for them.
Absolutely. That's exactly correct.
Okay, definitely. And then what would be the best way for patients to get in contact with you guys?
So the best thing is to go on our website. It's, as you said, newportplastic.com or drseify.com, SEIFY, and just they can fill a request for consult. They can call us directly, 949-251 1502. I mean, they can just Google my name. So yeah, and my coordinator would call them and they get in touch. We like to spend time. I like to make sure that everyone is really well informed, and then get the best outcome for them.
Yeah, definitely. Yeah, it's really clear to see that you care a lot about the patients and you want to make sure that, they ultimately have the outcome that they're looking for if it's possible.
Absolutely. That's the key thing, because as they say, a happy patient will bring you 7 more happy patients. And if the opposite is also the opposite.
Yeah, definitely. All right, perfect. Yeah, well, those are the questions I had for you. So I really appreciate you taking the time to talk with us today. Thank you.
Thank you very much. Very nice meeting you. I appreciate the opportunity.
Yeah,
Take
you
care.
as well. All right, have a great rest of your day.
You too. Bye-bye.